Morning, everyone. Thanks for joining our webinar. I'm Christy Schmidt, Director of Marketing and Communications here at Farm Credit East. Before we get started, we have just a few technology reminders. All attendees will be muted throughout the presentation. Every once in a while, just be sure to tap your mouse so that your screen doesn't go to sleep. And there will be time for questions and answers at the end of the presentation. But you can text chat those questions in at any point. There should be a red arrow in the upper right hand of your screen. Just expand that and there will be a text option in there, and you can text in your questions, and then we'll read them all to the presenter at the end of the presentation. And finally, a recording of today's presentation as well as the PowerPoint slides will be available following the webinar. You can visit farmcrediteast.com/webinars to find those materials. They'll be posted either later today or first thing tomorrow morning. If you have any trouble accessing those, you can contact me at 1-800-562-2235. And now I'll pass it over to Chris Lawton to get started.
Thank you, Christy. My name is Chris Lawton, and I'm the Director of Knowledge Exchange here at Farm Credit East. Among other duties, I produce our webinar series. And today we're very pleased to have Dr. Wesley Kline, who's an Associate Professor and expert on the Food Safety Modernization Act from Rutgers University. Dr. Kline has a BA from Salem College, a Master's from Cornell University, and a PhD in vegetable crops also from Cornell. He collaborates with over 300 growers and agribusiness personnel to carry out applied research and demonstrations that directly affect growers' livelihood in Cumberland County, New Jersey. He works to adapt new technologies to enhance productivity and profitability in urban vegetable production systems. Finally, Dr. Kline utilizes integrated pest management and sustainable agricultural systems for major specialty and controlled environment crops. So without further ado, I'll turn it over to Dr. Kline and let you take it away.
Okay, thank you, Chris. We're going to talk today about the Food Safety Modernization Act, which was signed into law in January of 2011. And this is really the largest change to the Food and Drug Administration since its inception over 70 years ago. I do want to make the comment that if you are already third-party audited by an outside firm, there's very little in here that will impact you directly. There's one issue in particular, which is the water issue, which we will discuss later on in the presentation. So, there we go. So there's 5 main parts to FSMA. Produce safety standards, which is the one that will affect most growers. The final rule will be published in October at the latest of 2015. This has been a long process for the whole act. It was, as I said, it was signed in 2011. The pressure really started to come to get government involvement after the 2006 spinach outbreak. Prior to that, the industry felt that they could regulate themselves. However, after that, there was a push to have some government involvement in regulations. And this is the culmination of that process. There's been 2 comment periods. All comments are closed at the present time. And I will discuss the changes between the first comment period and the second because it substantially was changed to really reflect what growers felt were concerns. And I'll discuss this as we go along. So there, as I said, in October of this year the final rule will be published for the produce safety standards, also for the preventive controls for human food. And this was the one that was the greatest concern with growers because it would have included packing house in this portion and would have added a lot of extra work for growers to comply. But that part has been changed, and I will discuss what those changes were, as I said. The 3 other parts to the proposed rule is the foreign supplier verification program. Supposed to be published around August of this year. In this case, this specifies what foreign suppliers will need to do to comply with FSMA. The preventive controls for animal food, which is essentially feed mills, will also be published in August. And there's been a lot of ongoing work in this area. It only impacts anyone who is doing essentially pretty much primary production of animal feeds. If you're selling it it's already processed, and this would not apply to you. The last one is the accreditation of third-party auditors, and the final rule will be probably sometime in 2016. And this really applies more to international than it does domestic. So we're going to concentrate today on the proposed rule for food safety, produce safety, because this is what really impacts growers mostly. The key principles that were spelled out by Congress when they passed the act was that FDA needed to consider practices and commodities. Also, they needed to be science and risk-based. They needed to focus on the roots of microbial contamination. They also excluded anything that was not normally eaten or rarely consumed raw, and excluded anything that's already processed as long as there was documentation of that processing. Also, Congress built flexibility into the rule. There was additional time for small growers to comply, and I'll go over those towards the end. There are some variances and alternatives that can be applied with certain provisions, and I will discuss those. I think the first thing we need to do, though, is talk about a definition of a farm. All definitions of farms are not the same, and in fact, the definition of farm changed between the first proposal and what is now the final proposal. Farm is an established under one ownership in one general physical location, devoted to the growing and harvesting of crops and the raising of animals, including seafood. The term one general physical location is not defined in the proposed rule. So we don't know if that means a farm next door or one in another state. Also, the definition includes the pack or hold of raw agricultural commodities, pack or hold processed food that is consumed on that farm or another farm under the same ownership, and the manufacturing and process of crops that are not consumed on that farm. In other words, juice sale. Drying and dehydrating is to create a distinct commodity. That's accepted under this proposed rule. Packing and labeling of raw agricultural commodities when no additional manufacturing process is involved is also included under the definition of farms. This was not true with the original proposal. That would have been in the preventative controls rule, which, as I said, would have added additional work to growers. Also, the definition of farm has been changed somewhat. A very small business or farm has an average annual sales of produce sold, that's an important word, of over $25,000, but not more than $250,000 during the previous 3 years. So it's the average, but it has to average within that range. A small business or farm, average annual sales of produce sold of $250,000, but not more than $500,000 during the previous 3 years. So there's quite a spread on these two definitions. So who would be covered? As I said, farms that grow, harvest, pack, or hold most produce in raw or natural state, normally raw or raw commodities. The list is very long of what is included and what is not. And when you look at the list, you'll be surprised for some things that are considered or not covered, such as figs, for instance. They're considered to be not eaten raw, although many figs are. Farm and farm portions of mixed type facilities, and I'll talk a little bit more about this, are covered. Domestic and imported produce, as I mentioned previously. Farms with annual sales less than $25,000 per year are exempt. They're completely exempt. FDA feels that sales of less than $25,000 is someone who has a self-serve out in front of your house, so it's not included. And there are limitations on coverage are proposed, and I will discuss those. So a farm or mixed type facility, the average monetary value of produce sold of $25,000 or more. Under the other or the previous proposal, anyone who had a packing house would have fallen under the other rule and would have added, again, a lot of extra work. However, farms will not need to register as a food facility merely because they pack or hold raw commodities grown on another farm under a different ownership. These activities would fall under the produce rule, not the preventative controls rule, which they would have done with the previous proposal. And this really helps growers. What about covered produce? Well, produce by definition in this case is all as fruits and vegetables, including mushrooms, sprouts, herbs, and tree nuts. Also mixes of intact fruits and vegetables such as fruit baskets. Produce does not include grains except for calculating sales in the exempt category. Now we'll talk a little bit about what that exemption is. And this is a qualified exemption. One thing it needs to be made clear is that to fall within that 250 to 500,000, it talks about produce sold. However, for the qualified exemption, it's food sold. It needs to be a very clear distinction. Food means everything, including grains, including if you have meat sold off the farm, it would include milk. So you can have a small vegetable or fruit operation, a large grain or dairy operation, and not qualify for this exemption. So the qualified exemption is average annual monetary value of food sold in the previous 3 years is less than $500,000, and it's sold to a qualified end user. A qualified end user is someone who has direct sales, for instance, a roadside stand, or if you sell directly to a restaurant, a retail store within the same state or within 275 miles of where it was produced. This means, for instance, if you have a supermarket that you sell direct to, but you also go through a broker who sells to that same supermarket, the broker sales are considered wholesale. Your sales directly to that retail establishment is considered retail. And your value must be higher for the retail than the wholesale. In other words, 51% of your product, food, must be sold retail. This is different than from the previous because before all food sold was included in, even if it wasn't an exemption. However, FDA changed it so it's just produce except for this qualified exemption. They cannot change food, the word food, because it's written into the statute. So this would have to be an act of Congress to change that to produce. Also, the requirement, doesn't matter if you have the qualified exemption or not, is there has to be labeling. When a label is required by the Federal Food, Drug, and Cosmetic Act, you need to have your name and complete address, for instance, on a box. If you're not required to do that, such as a roadside stand, a CSA, you must prominently display at the point of purchase the name and complete address of the farm, and that would be your traceability. So these are really traceability requirements. And if everything is electronic, then electronic notice would also qualify. There was a concern in the previous proposal about how an exemption would be withdrawn, and FDA has addressed this in their new proposal. FDA would notify a farm as to the reason for withdrawing the exemption, such as warning letters, recall, administrative detention. There is an appeal process that has been established, and also there's a procedure for reinstating the exemption included in the latest proposal. Before, there was no way that you could have your exemption reinstated, but it is now there. FDA is actually using this process right now. There have been several warning letters going out to some processing, and especially with the milk issue. So they are using this process at the present time. So let's talk a little bit about what the standards are for produce safety, and we're talking about microbial contamination. There's domestic and wild animals. I'm going to talk a little bit about each of these. Equipment, tools, buildings, and sanitation, worker health and hygiene, agricultural water, and I'll spend more time on that because this is, I think, the most critical issue for most growers. Growing, harvesting, and packing and holding activities, and the biological soil amendments of animal origin, and I'll talk a little bit about that. and also specific requirements for sprouts, which I will not discuss. If anyone is growing sprouts, they really need to look into this very carefully, because there's strict guidelines of what you do when you're producing sprouts. So let's talk about agricultural water. You'll notice it says Subpart E here. That's the actual part in the proposal where you would find that. So if you go to the FDA website or the FSMA website, and you can look under Subpart E and see what is listed there for water. So water is intended to or likely to contact food or the produce of food contact surfaces, including irrigation when applied direct, in other words, overhead irrigation, sprinklers, water used in pesticide application that you're mixing your pesticides with, growing sprouts, washing or cooling produce, making ice, or preventing dehydration. These are the things that they consider in direct contact or the food contact surface. So water has potential or intent to come in direct contact, and that is highlighted there for a specific reason. If it does not directly contact the produce, then it is not considered agricultural water by FDA's definition. So this is an example. For frost protection, it is not agricultural water if it does not contact the harvestable product. For instance, with strawberries, it may be agricultural water because you have fruit on the plant ready. But with blueberries, if you're watering the flowers for frost protection, it would not be agricultural water. And in fact, it could be the same water source, but in one case it would be agricultural water, the other case it would not be agricultural water. So the agricultural water must be microbially safe, and I will talk more about that. You need to inspect your water system at the beginning of the season and maintain the sources. And this is a completed inspection of all your sources, where there may be problems. It's really a risk assessment. If the water is not safe, your options are to discontinue use, and this could be at the beginning of the season or anytime you're using that water. You re-inspect the system, make your changes, test the water, or treat water. If the water is treated and you have the verification of that based on the chemicals you're using and you're monitoring it, then it's accepted and you do not have to do all these other things. Also, alternatives are permitted by the same level of public health protection. In other words, if you have data, scientific data to show that what you're doing comes to the same level of protection for the public as what is being proposed, then FDA would accept that. But you must have the documentation to show that when FDA would come to do an inspection. So what is the water quality criteria for direct contact with the crop? And again, it has to come in direct contact with the harvestable portion. All water must have less than 126 CFUs or MPNs, in other words, colony-forming units or most probable number of generic E. coli per 100 mils of water, and using a geometric mean. I'm not going to discuss what a geometric mean is today. This may or may not be in the final rule, and at that point it would be more important to discuss it because it is a mathematical equation you need to use. I would caution anyone who goes online and looks up geometric mean and goes on one of the websites to use that as your calculator. Some of those calculators are not correct. We have looked at several of them, and some of them are not correct. FDA will come out with fact sheets and I think an online place where you can do your calculations. The other thing is less than 412 CFUs or MPNs of generic E. coli with a statistical threshold value. Again, I'm not going to discuss that, but there are calculators for that, and FDA is supposed to be coming out with how you calculate these if they're in the final rule. So if water contacts the harvestable portion of the crop, risk may be reduced by maximizing the time between application and harvest. In the proposed rule of FSMA, it has come back with a die-off of 0.5 log per day between the last irrigation event and harvest. This is really important for someone who's using surface water and they do not meet the standard criteria for safe water. This was not in the original proposal, but it is now. And I'm going to show you an example of how this would work for growers. In this example, the water was tested and has 1,000 CFUs per 100 mils of water. If you wait 1 day between application and harvest with a 0.5 log reduction, you end up with 330 CFUs per 100 mils. If you wait 2 days, you're down to 106 CFUs, which is well under what's accepted for irrigation water. So I think this is something that many growers will use. It will make it much simpler than doing all the calculations. And they are to come out with a series of tables about this also. So why do we use generic E. coli as an indicator? Well, it is an indicator organism. It's one that's been accepted by many people. Is it the best? No. But it does fit for many situations. And as I said, it's accepted across the industry. Why don't we use total coliforms? Well, if you notice this circle here, total coliforms is pretty large. We can pick up lots of total coliforms that are not pathogenic. With E. coli, again, it's a readily accessible test. It's relatively cheap. It does give us a good indication. So that's why we rely at the present time on generic E. coli. So when you're evaluating your water system, the only way to really do it is to test. And tests can help you understand the quality of your water source, establish a baseline water quality so you can best know how and when to use it. And I'm going to talk more about that baseline in a minute. And also help you determine if you need corrective action, how you're going to correct that action. So I'll talk a little bit about pre-harvest water testing, what you need to do, what you don't do. You do not need to water test if you're getting your water from a public source. And you can get a copy of their report. And most public sources, they're tested at least quarterly. Also, you do not need to test if you treat your water. And as I said before, you have the information to back that up. In other words, what's the chemical used? It was approved, an EPA number on it. It must be approved chemical. And you have the monitoring to show that it's working at the accepted levels. So let's talk a little bit about the baseline. This is for untreated surface water, another ponds, streams, rivers, or it could be a retention pond. This is new proposal by FDA. The old proposal was for surface water, you would test every 7 days. And they received a lot of comments about that. So this is their present proposal. You established a baseline of your water quality. You do this by taking a minimum of 20 samples collected as close to harvest as practical over 2 years to establish your geometric mean and your statistical threshold value. This will be a concern for growers who only may irrigate once or twice a year. And actually, this will be a concern for growers who even irrigate more. But this would have to be done over a 2-year period. Let me show you how this will work. If you look on the left side of the screen there where it says Start, you establish your water quality profile. You take 20 samples over 2 years, as close to harvest as possible. Then after that, you take 5 samples a year. If the 5 samples are within acceptable range of your water quality profile, then you continue to take 5 samples a year. Then after 10 years, you have to reestablish your water quality profile. However, if those samples do not match your profile, then you have to go back and do a new profile and collecting those 5 samples plus 15 more. Alternatives is to use that dieback, that 0.5 log dieback that I mentioned earlier, which I think is a good option. Also, time intervals between harvest and into storage may also provide dieback. However, you have to show that it is actually happening. FDA are not using that 0.5 log dieback after harvest. Also, the other thing is any other activities you may do, such as washing the produce, you can also factor that in, but you must have the data to show that. And the other thing is to continue use. So, if your baseline is higher than the proposed microbial water standard, you need to take action. You need to do something. You can investigate the water source for possible causes, such as manure application and runoff. It could be your neighbor that has done something and not just you. For instance, I had a grower who was growing spinach and his neighbor was putting on manure, dry manure. There was no problem when he started to do it, but the wind shifted and it blew over onto the spinach. He had to make a decision what he was going to do prior to harvesting. And it actually was it was small enough, was able to handle that and was able to harvest. You also have to assess the wildlife fecal contamination. Is there any concern about, you may have hooked in a pipe, for instance, that was used to spread manure and you hooked it into your irrigation system. Also, is there any problems around your wellheads or the animals around your pond? And you can take corrective actions to reduce this. As I said, you can treat your water source as long as you're using approved chemicals and you're monitoring how much you're putting in, how often, and using the dieback. And again, I think the dieback is a good option for many growers. This shows you a slide of data that was actually collected. And normally what we will see when we're collecting data is when you get later in the season, this is over 2 years, you'll notice the first year they were all below that 126 level, which was very acceptable. But the second year in July, they had a big spike. In August, they had a big spike. This is very common that we see, especially when you get into the July, August, and sometimes September. You have, with the surface water, you get a lot more activity. You will get things running into it. You may have more wildlife activity, for instance, upstream from the source, and these values are very common. If you do a geometric mean, then these may be within acceptable levels. But if you get these spikes, then that's what you really need to assess what the problem is and where your possible risks are. So what about groundwater? How often do you need to test it? You need to test it 4 times during the growing season or over a period of a year. If the test had no detectable level of generic E. coli per 100 mils of water, or a geometric mean of 126, then you can go to once a year. And as long as that stays within that 126 level, then you continue testing just once a year. If it doesn't, then you need to go back testing 4 times a year. So if you have groundwater sources, wells for instance, it's much easier to comply with this than it is for a surface water. What about post-harvest water testing? And since this was not in the original proposal, because you would have been in the other rule, you would not have found this, but this is in the proposed rule right now. You must test agricultural water using a quantitative or a present absence method, and you need to have no detectable generic E. coli levels for the water. And this would be true for your sprout water, any direct contact during harvest or after, and any making ice, or for the contact with the food or food contact surfaces, hand washing during and after harvest. These all must have no detectable levels of generic E. coli. So the way you look at this is, if that piece of fruit, that apple, it is going to have water on it, that water must have 0 amount or non-detectable generic E. coli. Also, if you're circulating water using dump tanks, for instance, you must have a water change schedule. And you have to do essentially a risk assessment to minimize the potential contamination of the product in the food contact surfaces. You need to visually monitor the quality of the water in the dump tanks or flumes, wash tanks or hydrocoolers for a buildup of organic material. This can be, you're really talking about turbidity of your water. And it's relatively easy to monitor this And if this is still in the final rule, then it can be discussed at that point. But it's relatively easy to monitor that. Also, monitor temperature to minimize potential for infiltration of organisms. In FSMA, it does not specify what commodities you need to do this for. Within some third-party audits, it would tell you which commodities you need to monitor the temperature. But within FSMA, it says, as that statement is there, it's potential for infiltration of microorganisms. You need to monitor the temperature. So let's talk a little bit about soil amendments related to animal origin. Growers were very concerned when the original rule came out. If you remember, the proposal was for 9 months from application of manure to harvest, and for compost it was 45 days. FDA looked at that and looked at all the comments and have made some changes which we will discuss. So a biological soil amendment of animal origin we know may contaminate it. The requirements are to have standards for handling, conveying, and storing, and also treatment methods, except application methods and application intervals. And we'll talk about each of these. Also, this is the second one where you can provide alternatives if you again have the data to show, the scientific data to show that the way you're doing it has the same public health protection as the way FDA is proposing. Those water and biological soil amendments are the only two places where they propose alternatives. So what is untreated soil amendments? They're considered highest risk since they have not been treated to reduce or eliminate pathogens. All the following are soil amendments would be considered untreated: raw manure, aged or stacked manure. This has been a question that's come up several times, whether that would be considered compost or not, and under FDA rule it would not. Untreated manure slurry, compost teas made with raw manure, or also compost teas made with some additives, because some additives actually are based on raw manure and have not been heat treated. Also, any soil amendment mixed with raw manure would also be considered untreated. Let's talk a little bit about composting. As we know, composting is a controlled biological process that decomposes organic matter and reduces pathogens. Temperature is the main method to reduce the pathogens, and there are other factors also, the amount of die-off that you may get over time. FDA says that only an approved scientifically valid composting process ensures adequate pathogen die-off. You also need to monitor how you're doing it, and you need to keep records to ensure that the compost is safe. So you would need to be monitoring the temperature, for instance, how long it's in the piles, how often you turn it, and you must keep those records. There are two methods that FDA considers scientifically valid. One is a static composting, which you're actually pumping air through the pile. It must reach a minimum of 131 degrees for 3 days, followed by a curing. And the curing includes covering that pile with insulation, for instance, about 6 inches thick, to ensure that it doesn't get recontaminated and the whole pile actually gets up to 131 degrees. And this is a problem with some compost piles when the center will be at 131 degrees and the outside will be ambient temperature. So that's a critical issue with static composting. The other method is the turn composting, which again is aerobic, again the same temperature, 131 degrees for 15 days, a minimum of 5 turns, followed by curing. If you have another method that would reach these temperatures, and to make sure that the total pile is actually has no raw manure in it, then that can be used as long as you have the scientific data to assess that. And you would be needing to look at things like Listeria, Salmonella, and E. coli 015787 as indicators of whether that pile has actually done that or not. You would only need to be looking at those if you are suggesting an alternative to these two methods. As I said before, in the original proposal, FDA was saying that you had to wait 9 months after application of manure. That's no longer the case. There's no application intervals for raw manure. But what FDA is saying, you should continue to use the National Organic Program guidelines for a standard until they review additional research. There's a lot of active research going on related to raw manure and how long you have to wait before you apply it. I would expect that FDA will be coming out with new rules sometime in the future. Also with treated soil amendments, in other words, compost, there are 0 days to application, which again was different than before, which was 45 days. So FDA has really made a lot of changes in the manure issue based on grower comments. But again, I expect to see this will change sometime in the future as more data becomes available. But what about record keeping for soil amendments? You need to have the type and source of the soil amendment, the rates and dates that they were applied, the treatment, especially if you're buying in compost, you need a certificate of analysis and any microbial testing that was done on that compost. And many of the commercial producers of compost now have been through this, so they are readily available to provide you that information. You also have handling and sanitation practices used to reduce risks. Many of the things in FSMA are really risk-based. You look at your situation, determine where your risk may be. Storage also needs to be considered to minimize runoff and leaching and wind drift, prevent contamination of crops. As I mentioned before, that example of the manure, dry manure going onto the spinach. Some of the things you can do is cover the pile, build a berm to prevent runoff. I've had a grower who's had to do this because of concern with a neighbor who actually had horses and they were getting runoff into the field, so they had to build a berm around their field. You do not store, obviously, any of this uphill from where your water source is, your field is, and you keep raw manure separate from your compost, so you prevent cross-contamination. One issue we've had with that is that if you're making compost, your own compost, using the same equipment, you can easily cross-contaminate a finished compost pile with one that's just being established. So that's one thing you have to take into consideration. Let's talk a little bit about worker hygiene, health and hygiene. We know this is a big issue and is one of the main sources of cross-contamination. We know that pathogens can be transmitted from people to food. Under training, I have one example there, and that's a very specific example. If a farmer sells the entire field pre-harvest, food safety training is the responsibility of the new owner. Or if a crew is hired, the crew leader is responsible. However, you should verify that they have had food safety training. This applies, it may not apply much in New England, but it does apply some in the Mid-Atlantic and further south. Also, you need to prevent contamination by ill persons. And I'll talk a little bit more about those. As I said before, we know that workers are a food safety concern because they carry human pathogens. Shigella is only carried by humans. You have hepatitis A, norovirus, and there's many others. Workers can spread this during harvest and packing with their hands. The fecal oral route is the main source of contamination. It's more prevalent than we want to believe. There is required training to reduce the risks, such as proper hand washing and how to handle injuries. And I'll talk more about those. So who needs to be trained? It's all employees, whether it's in the field or in an office, seasonal volunteers, interns, contract personnel, and family members. Everyone needs to be trained in food safety based on their responsibilities. If you have someone in the office, it may not be a very detailed training, but they must be trained. And they must be trained at the beginning of the season and periodically thereafter. The periodically thereafter really relates to, is there an issue that you're observing that you need to retrain? It may be a whole group or it may be an individual. Also, the training must be conducted in a manner that is easily understood. In other words, if you have all Hispanic workers, the training needs to be in Spanish. If you have others, it needs to be in another language. But they must be able to understand what the training is and why it's important. I think we all need to remember that our field workers are really food handlers. It's no different than someone in a restaurant that's waiting on you. Okay, worker training must include, as I said before, how to properly use toilets and wash hands, the importance of personal cleanliness, what to do when there's injured or illness, how to implement a practice to reduce food safety risk while working, such as inspecting containers, inspecting equipment, looking at picking baskets before you start to harvest, are they clean or not, and how to communicate food safety risks to or with managers and supervisors. In other words, part of the training is making your workers feel comfortable to express to you that there may be a food safety risk in this case. Proper hand washing is one of the big issues that we all need to make sure we're doing training on. This is just one of the examples how you should be doing it. You wet your hands with water, apply soap and lather. We're talking about soap. We're not talking about hand sanitizers. As you notice on the bottom of there, antimicrobial hand sanitizers are not a replacement for hand washing. If you want to use them, fine, but individuals must wash their hands first before putting on a hand sanitizers. And they want to make sure you wash the fronts and backs of your hands between your fingers. Watches are a notorious problem with holding potential pathogens. Rub your hands for at least 20 seconds. Rinse hands thoroughly with clean water. Dry with paper towels. Turn off the faucet with a towel and throw it in a trash can. That's a basic system for washing your hands. 20 seconds, if you've gone through this, is a long time. It seems like it's forever. But you can sing happy birthday a couple of times or something else which will cover that length of time. So when do people need to wash their hands? Before starting work, before putting on gloves. Gloves are not a substitute for hand washing. After using the toilet, upon returning to work, as soon as practical after touching animals, and we'll talk a little bit more about animals later on, and any other time the hands may become contaminated. Also, if you are using gloves, they must be maintained in an intact and sanitary conditions. If a glove rips, it needs to be replaced. If you're using reused gloves, heavier gloves, there must be a way to sanitize those gloves. Visitors. Everyone except your personnel is considered a visitor by FDA. They must be aware of the policies and have access to a toilet and hand washing facilities at your operation. So anyone who is not working for you is a visitor, whether they're there just to pick up some produce. The easy way, I think, to do this is to make them aware of the policy is you have a sign. Wherever visitors normally come in, have a sign up there what you expect them to do. And this can be as simple as saying, we have toilet and hand washing facility available. Please ask the supervisor or please check in with the office. Something like that, which is readily visible. You do not need to have visitors sign in and sign out. You just need to make them aware of what you have for food safety. Resources that must be provided, again, are toilets, and the number of toilets, whether it's based on OSHA standards or if your state has stricter standards, you have to follow them. So it's whichever is stricter. Toilet paper, soap, clean water for hand washing, paper towels, garbage cans, first aid kits, and break areas. And break areas can be simply a farm road, not eating in the field, but eating in the farm road or on the farm road. You must have record keeping of the training that you provide, and this just gives you an example of a small page that could be used sheet. It has the date on it, the name of the trainer, the material you provided, the printed name of the person who took the training and their signature, and the manager's signature at the bottom and dated. This is your record that you provided training. So let's move on and talk a little bit about equipment, tools, and buildings. This is in Subpart L. The requirement is for the equipment and tools must be designed and constructed to allow adequate cleaning and maintenance. Food contact surfaces of equipment and tools must be inspected, maintained, cleaned, and sanitized as necessary. There is no specified time of how often you have to do this when you do it. You really decide when you're going to do this. Buildings must be designed and constructed to allow adequate cleaning and reduce potential for contamination. And that is just mainly looking to make sure that you don't have something where you're going to be able to collect a lot of dirt on top of. You construct it so you don't have a pest problem. We'll talk more about that in a minute. Also, you must have adequate, reasonably accessible toilet and hand wash facilities in or adjacent to the building. So this must be readily available for all your workers. You must have, again, the toilet and hand washing facility. So the question has always come up about whether you have to have an enclosed packing shed. You do not. It can be open to the environment with some open sides. It actually even could be a canopy as your area for packing. If it's closed, then the doors have some ability to control entry into the building. So it's very simple. You do not need an enclosed packing shed for FSMA. You do need to keep things clean during post-harvest handling and to reduce contamination. And the things you should be considering is the packing containers, how often those are inspected or cleaned. Your packing equipment, hands and clothing, as we talked about, the post-harvest water we talked about, the type of building, which includes your coolers or your storage areas, and the transportation vehicles. These are things to really consider as you're doing cleaning and sanitizing. And I've already talked about some of this. I've talked about the hand washing. I've talked about your pest control, keeping it clean in the packing house. Your pest control, you must have a pest control program, which you can do yourself. You do not have to hire anyone to do your pest control program. For an enclosed packing shed, it's much easier. For an open packing shed, as long as you can keep pests, meaning birds, rodents, out, that's acceptable. You may need to put, for instance, bird netting down on the sides to keep the birds out, or some other way. Within a packing house, we've had questions about whether you have to put in a full ceiling, as this picture shows. You do not need to do that. You can, even if you have rafters, as long as the birds are not getting in, that's acceptable. You do not need to put up netting or anything if the birds stay out. The standing water in the middle is an issue. This was one thing that came up in the cantaloupe outbreak in 2011 because of standing water on the floor. And this is part of that construction. How are you going to remove the water from the floor that doesn't stand there? I see this many times with growers who continually increase the size of their packing house, and the floor isn't level and doesn't flow directly to a drain. So this is one thing you need to take into consideration. As I said, the break areas, for instance, in a packing house can be a picnic table outside, or it may be something inside you just mark off with, for instance, yellow tape to show where people can eat. They cannot eat on the line. They cannot drink on the line except for water. So that's one thing you need to take into consideration. Let's talk a little bit about domestic and wild animals. The requirement applies if there's a reasonable probability that animals will contaminate covered produce. And FDA is looking for fecal material. They're not looking for the number of animals. So the requirements are to, if you have a problem, wait an adequate amount of time between grazing and harvesting. FDA does not define what this time frame is. Thus it's difficult to say what's an adequate amount of time. If working animals are used in a growing area, measures need to be taken to prevent pathogens from being introduced, and I'll talk more about that in a minute. Also, you must monitor for animal intrusion, and if observed, evaluate whether you're going to harvest that area or not. You're really looking for visual contamination of a covered product. So we know animals can be a problem because they carry, for instance, E. coli 015787, Salmonella, especially with birds, Listeria, many others. And they can spread human pathogens by fecal material in the field or cross-contamination in other cases. They are part of a growing environment. We are not going to exclude or eliminate all animals. Fencing is an option, but again, fencing can be breached, and birds and small animals can travel unnoticed. So it's a matter of managing animals. Assessing the risk of wildlife, and you can do this prior to the season or just as you're planning to help determine whether you're going to have a problem in the field or not. How often do you see feces? Is it widely spread? It may only be in a small area along the woods. Did it contact or will it contact the produce? Is your farm in an area where there's a large amount of animals, such as migrating birds or herds of deer? What management practices can limit wildlife contamination? It may be fencing of a pond, for instance. It may be using bird scares. It may be using the cannons. It really depends on your situation. Each farm is unique, and it must be assessed that way. What about domestic animals? You need to ask yourself, where are domestic animals allowed? Are domestic animals allowed in the field when the crop is present as part of the production process, such as working animals? Is runoff likely to flow from pastures, corrals, or manure storage locations into production or packing areas? And we have seen this, as I mentioned before. Is pet access to the fields and packing areas controlled? This can be a very important issue, which I will discuss a little bit more. Are workers aware of cross-contamination risks from fecal contamination? Hands, gloves, shoes, walking through fecal material when you're handling animals and you go in and walk through a field somewhere, or even more into the packing house. Do animals graze call or crop residues in the field? And I've seen issues with chickens, for instance, on small operations, going through an area which actually was going to be harvested. Is the production ground rotated into pasturing land? And that, again, these are just considerations, but FDA is not saying exactly how long you need to wait from the time that animals go in until you harvest. Let's talk a little bit about monitoring for wildlife activities. You do need to monitor for them. You're monitoring, again, for fecal material, evidence of intrusion. You need to evaluate how much that contamination may be an issue. For instance, trees versus root crops. If you have fruit trees and you're not picking up drops, which you should not pick up for raw production, then it may be less of an issue. Consider what you've noticed in the past. Immediately prior to harvest, again, you need to scout for fecal contamination, signs of the activities, and assess the risk and decide whether a portion of the crop can safely be harvested or not. And it's only you that can make that determination. With working animals, you need to limit where the working animals access the field and making sure that they're not going into the edible portion. The plain people have worked this out very well. They have standard operating procedures on where the animals go, where they're allowed to go, the people who are working with the animals, what they are allowed to do, such as not touching the produce, but only driving the horses. So these things need to be taken into consideration. Also, afterwards, washing your hands, cleaning, sanitizing tools, anything related to working with those animals. Pets can be an issue. They should be excluded from production fields, especially close to harvest. Our greatest concern is that close to harvest time, because you have the highest potential to contaminate a lot of product. You should be excluded from packing areas to prevent contamination. Also, visitors to a farm, such as with a U-Pick business, you should instruct people to leave their pets at home. not in the car, because if it's a very hot day, and one, you have a problem with an animal, second of all, someone's going to open the door and the animal is going to be out. So you need to instruct people not to bring pets to the farm if they're doing U-pick. You do need to do a pre-harvest assessment, and this really is looking, again, as I've been talking about, the fecal contamination present. Are there signs? Are there tracks? What is the possibility? Do you need to have buffer zones around a certain area? Is it safe to harvest the whole field or just parts of the field? To talk a little bit about the growing and harvesting and packing and holding facilities. The proposal includes science-based minimum standards for growing, harvesting, and packing and holding, which is mainly what we've been talking about. The requirements are, this is an important one to take into consideration, which is in yellow. There must be a food contact sanitation step between covered and excluded produce during packing. Now, if you are doing exactly the same practices with your covered and excluded produce, then this does not apply. However, if you are packing a product that is not considered a normally eaten raw product and it's handled a different way, you must have a sanitation step in your packing process. For food safety reasons, this makes sense because you can separate one lot of produce from another lot of produce by having that sanitation step. Practically, it can be an issue, I know, with growers because of we need to get everything packed now. But this is something you need to take into consideration unless it gets changed in the final rule. Not distributing covered produce that drops to the ground before harvest unless it receives commercial processing if it's a crop that's grown, for instance, in a tree. And food packing materials must be for appropriate use. This has been an issue with growers. What is appropriate use? Wood containers, canvas bags are acceptable, but must be sanitary. Sanitary means visually and smelling it. Do you smell anything that may be a contaminant? Do you see anything that may be a contaminant? That's what sanitary means. For instance, wood, you cannot sanitize wood, but you can make it sanitary. Also, any sanitizer or disinfectant used must have an EPA pesticide label. This is an ongoing issue which there's been a lot of discussion about, but it must have an EPA label. We've discussed records a little bit, but let me just say that examples of the records of the water tests that I mentioned before, the conformancy for your compost, any records that you already maintain. For instance, an organic grower has much of these records already done. You do not need to duplicate them. The grower will need to be able to trace their product, but the traceability, what we talked about at the beginning, was that sign if you have a roadside stand with your name and address on, the same thing with the box. All records must be kept for 2 years. They can be stored off-site. They can be stored electronically. If there are paper copies, for instance, it must be on site for 6 months, and after that they can be stored off-site as long as you can get them within 24 hours. Because FDA may call up or may visit and want to see certain records, but you have 24 hours to produce those. It doesn't matter whether you have a qualified exemption or not. FDA has the authority to shut a farm down if they're producing a dollar-rated product. If they see something that is considered unsafe, they have the authority to shut a farm down. Let me talk again a little bit about the alternatives. I mentioned it before. Farms may establish alternatives to certain requirements related to water and biological soil amendments of animal origin. Those are the only two that they will accept alternatives. Alternatives must be scientifically established, provide the same amount of protection as required in the proposed rule without increasing the risk of adulteration. You do not need to send those alternative scientific methods. You have to have them available if an FDA inspector wants to see them. but you do not need to submit them to anyone. However, there is a variance provided for a state, a region, or a foreign government. They can petition FDA for a variance on some of the provisions if they think that it will affect local growing conditions. In this case, the person or government or region that's doing this must provide the information to FDA, and FDA makes an determination whether it's accepted or not. All of this information will be available through public records. So if you want to check on someone, for instance, who's asked for a variance, you will be able to have access to that information. This is probably one of the most important things that you want to know about, is when does this take effect. For a very small farm, again, the average sales is greater than $25,000, but less than $250,000, you'll have 4 years from the effective date. And I'll give you that example of that in a minute. For a small farm, which is over $250,000, but not more than $500,000, you'll have 3 years after the effective date. All other farms, in other words, larger than $500,000, will have 2 years to comply, except, again, for water and for record keeping. There will be 2 additional years added onto each of these farms. The very small, and other farms will have 2 additional years added on. So let me show you a sort of a graph. Will give you an idea what this means. So, in theory, the final rule is published in October 2015. The effective date is 60 days after the publishing of the final rule. Large growers will have 2 years, which means December of 2017, and they'll get 2 additional years for the water and the record keeping, so that's 2019. Small growers will have 3 years, so that's 2018, that's 2021. Very small growers will have 4 years, so they don't have to start to comply until December of 2019, and you add 4 more years to that. So that's 2023. So the complete implementation, that should read 2023 instead of 2021. So there is plenty of time when the final rule is published to look at it and determine how you fit into that final rule. It's not something you have to do immediately. And that's a critical issue because it may cost you some money to comply with this final rule. Let me give you an example. This is the estimated costs that FDA has come up with. A very small grower would cost somewhere around $4,600 to comply. Small growers around $13,000, and large growers around $30,000 to $31,000. So there are, if you have not done anything related to food safety, it is going to cost you some money. There is no question about that. The other thing is that everyone must have at least one person on their operation who has successfully completed a food safety training. And the training course must be recognized by FDA. So there will be trainings available in the not too distant future. There actually have been a couple held already. But you will need to be trained, and you'll need to be trained by someone who's recognized by FDA. And that will mean one, even if you have a third-party audit and you've gone through food safety training, right now you will also have to go through this training. And most of the trainings are day long. I just want to mention the preventive controls for human food. It has much less impact now on growers because packing houses are considered in the produce rule. However, just to mention it, you would have to do a hazard analysis and risk-based prevention, essentially a HACCP plan. You would have to register your packing house with FDA. You would have to have a written plan. And as I said before, under the produce rule, you do not have to have a written food safety plan. You have to have the records. However, with the preventive controls, you must have a written food safety plan. You must talk about how you're going to do corrective actions. You must have a verification procedures. You must have a recall plan. This is really an update of good manufacturing practices. And that's really the reason why growers don't have to comply with this unless they have just a packing facility. FDA has a very good website and I would suggest everyone should get on this website. You can subscribe to it. It will send you alerts when there are changes. There's a lot of information on there. Everything from this presentation really has come out of what's on their website. Also, there's technical assistance available. There's a Produce Safety Alliance, and you can see the website there. It's hosted at Cornell. There's also one for the preventive controls and for Sprout at the Illinois Institute of Technology. That is their website. They both have a lot of good information that you can download. FDA will be coming out with a series of guidance documents, and also they're in the process of establishing a National Technical Assistance Network. Both of these should be announced shortly after the final rule is written. FDA is going to rely on partnerships to make all this work, and most of those partnerships will probably be with the State Departments of Agriculture or the State Departments of Health. So those are the people you should be talking to about your local needs. And that brings us to the conclusion of my part, and I'm now available for any questions.
Okay, thanks, Dr. Kline. We actually have quite a few questions here, and people can continue to text them in as we go through the Q&A period. I'll give you the first one for now. Does produce apply to animal products or just fruits and vegetables? I assume that must be relating to the eligibility or the coverage issue.
Yeah, for the qualified exemption, under the qualified exemption, animal, for instance, if you butcher an animal, that would get counted in that total. If you're not concerned about the exemption, then no. It only covers fruits and vegetables normally eaten raw.
Okay, but just to clarify, let's say you're a dairy farm and you start growing tomatoes on the side, you would likely get tripped up in being covered because you have a large volume of product you're producing, counting the milk.
That is correct. That's the qualified exemption. And until Congress changes that, FDA cannot make the change.
Okay. You mentioned that about the log reduction of E. coli. Is there an equation that can be used to calculate that log reduction before the FDA releases sheets on it?
There is. I honestly don't have the reference right in front of me, but we can find that.
Okay. Regarding the manure standards and as it relates to National Organic Program standards, are the NOP rules from raw manure 120 days if produce has ground contact or 90 days if it does not?
That is correct.
Okay. You went through there's a question about compliance timeline, which you went through, I think. I don't know if we need to revisit that. But one question was some of the things that you presented today are final and some are not finalized yet. Could you just clarify a little bit about that?
Yeah, in reality, everything I presented today is not final. What I presented was what is understood today. But until FDA publishes that final rule, we don't know what's accepted and what's not accepted.
Okay, thank you. And do you know when that final rule is due out?
The final rule needs to be published by the end of October of 2015 because FDA is under a federal court order to have it published by then.
Okay. What about the regulatorily required training for the qualified individual?
The training, again, FDA has to approve whoever is going to do the training. There is a process going on right now where there is a training that has been approved. It has been piloted in at least one location. Also, the trainers must be approved by FDA through a process, and that has been established. I would expect you'll shortly be hearing more word about when training will be available and where. In reality, at the present time, there are very few trainers who would qualify to train for FSMA.
So I imagine possibly after the rule is finalized, we'll start seeing things from like Extension or possibly private agencies that will come out and offer training.
Yeah, that's correct. You'll be hearing more. And remember, the largest growers have 2 years to comply with this. So you don't have to have that training until you have to start complying.
Okay. Another question we have here is, it's frequently mentioned that risks must be assessed. How or should these assessments be documented, since there's no requirement to have a written food safety plan?
That's correct. There is no requirement, as we know it today, for a written food safety plan. The requirement, though, is to have documentation. My suggestion is that a grower go out, look at their fields, and write down what they're seeing. For instance, you go out and you stand in the middle of your field, you see if you have a neighbor who may be up above you that have horses. Is there a possibility that would run into your field? Is there an ongoing wildlife issue? Making notes like that, there is no form, it's how you make it up.
Okay. So it's probably not necessarily a bad thing to have a written food safety plan, it's just not required.
Yeah, that's exactly right. I think it makes sense to have a food safety plan written, but is not a requirement. So the records you keep, you have to decide how you're going to keep them.
Okay. Here's a question. I'm not sure exactly what it's referring to, but hopefully it is familiar to you. Any thoughts on the proposed PC rules, supplier verification rule, and the impact on growers?
I'm not sure exactly what.
I guess maybe they're talking about preventative controls.
Oh, okay. Would you repeat the question, please?
Any thoughts on the proposed PC rules, supplier verification rule?
No, I honestly don't have any knowledge about that specifically.
Okay. Here's another one. We talked about FDA conducting inspections. Under what legal authority does FDA have to conduct routine inspections?
Congress has given them authority in FSMA to do the inspections, and they have the legislative authority to do that.
Okay. The questions are coming in, which is great. One of the things discussed was the idea of alternatives being acceptable in, I believe it was water and manure, but the burden was on the farmer to have support for those. A question came in that they thought alternatives might have been dropped in the supplemental rule.
No, that's not true. They are in the supplemental rule, and very clearly stated in several places.
Okay, but the burden remains on the farmer to actually have some kind of backup for their alternative.
That's correct. I mean, they can rely on published data. They can find it. They can rely on someone else to create it, but they have to have the documentation.
Okay. We got a clarification question about the difference between the sales amount relating to compliance when it applies to just produce and when it's the entire farm's sales.
Total farmer sales is for the qualified exemption. That's when that applies. As far as being required for whether you have to comply at all with FSMA, that's based on only produce.
Okay.
I mean, that is somewhat of a catch-22, because the amount of produce you sell may be a lot less, so you would be exempt. Say you would be below the 25,000. But if you want to follow the qualified exemption, it may throw you into it. So the first thing I would do as a grower, I would look at what the produce I sell retail and how much it is, the value. The other thing, also, FDA has not said how that value will be calculated. They have not said whether you're talking about receipts or what they're going to use.
Okay. We have some more questions in that line of thought. If a farm is exempt, or believes they are, less than $25,000 in produce sales, do they still need to count monies for all food sales, such as the dairy example we referred to earlier?
What I believe is that if you have less than 25,000, you would be exempt if it's for produce.
Okay. How about irrigation water used for young plants? Would that have to be tested? I assume here we're talking about like vegetable starters. That would be quite a ways from harvest time.
That's correct, and it's very similar to that example I used with the frost. The water comes in direct contact with the finished product.
Okay, so if you're like starting tomato plants or something like that and you're many days from harvest, you probably don't need to test that water. What I'm hearing?
That is correct. As long as there's not a finished, again, a fruit on there that would be harvested.
Okay.
Or a leafy green, for instance.
Okay. Another question that came in about cost of compliance. Cost of compliance for small farms as a percent of revenue is dramatically more expensive than it is with larger farms. Is that being addressed in any way or funded in any way by either FDA or USDA or anything like that?
I mean, that's a good question. There has been discussions by FDA and others, USDA, about possible some type of program to help subsidize that. I'm not sure what the status of that is. I do know in some states, for instance, if you're getting a third-party audit, that the states are subsidizing those, but that varies from state to state. And I would guess that's the way it will be with this also.
Possibly could be some cost sharing down the road.
There possibly could be some cost sharing, but I have not seen any published information about that.
Okay. We've got a specific scenario here. A customer that raises rabbits where manure is occasionally applied on composted. So where do they stand? They would have to comply with the number of days to harvest rule, correct?
That's correct. I think the way you need to do, if you're doing composting and in a situation like that with rabbits and you're having rabbit pellets you're putting on, you should have one pile where you're doing that and you have another one that's being as a finished compost. You cannot mix the two.
Okay. And so the rule for the final days to harvest for uncomposted manure is it's the 90/120 depending on ground contact?
That's correct.
Okay. Question about water testing. You mentioned 20 samples over 2 years, and you mentioned as close to harvest as possible. So how would you go about taking those? Would you take samples evenly spaced through the year, or would you take a bunch of samples the week before harvest, or how would you go about doing that?
That's a good question, and it's right out of the proposed rule where it says as close to harvest as possible. In reality, I think what you're talking about is spacing them out. They may be a week apart, they may be 2 weeks apart. They do not say what as close to harvest as possible means.
Okay. So if you're trying to get a baseline that doesn't exceed the standard, you might want to space them out more because your biological contamination is likely to be highest in the summer months. Wouldn't that be correct?
That's true, but I think also you're taking those samples when you have production.
Okay.
And the reality is you're not going to, if you're using a pump, you're not going to start pump up in the middle of December or in this year, middle of March, to try to get a sample.
Yep. Question about compliance timelines. You mentioned the different scenarios of 2, 3, and 4 years to comply for different size farms. Is that when does the clock start ticking on that? Would that be after December 2015?
That's correct. It's after the effective date of the rule, which is December of 2015.
So we're really looking at let me just count ahead here, 16, 17, like 2018 growing season for the first earliest compliers.
For the largest growers, it would be 2 years, so you're talking, that's correct, because you'd be in the middle of the winter. That's correct,
Yeah,
in the Northeast.
Okay. Here's one here. This is something we actually talked about previously. Being a CSA grower, purchasing a few products for your members from other growers, can you elaborate on how that affects their compliance?
This is somewhat of a gray area, which I hope FDA is going to flesh out a little bit more. I think you are fine with under the produce rule, but to be honest, they need to be a little bit more clear of how that fits in.
Okay. Here's one question about if you're, say, a farm stand, does the produce volume relate to just produce that you grow, or what you grow plus purchase for resale?
What you grow plus what you purchase if you're looking at the qualified exemption.
Okay. Another question on the compliance timeline. We looked at, we talked about there's different milestones that occur. How did you get to 2023 as the last compliance milestone? Wouldn't it be 2015 plus 4 years?
Plus 2. So
plus
15, 4. Yeah, I guess I misspoke. It is not quite that long.
Okay.
So for the smallest grower, you're looking at 4 years from December of 2015 plus 2. So it's 6 years total.
Okay. Another question that came up is if you're a produce grower that grows products, some of which is covered under the produce rule and some of which is not. In other words, some produce that's consumed raw and some that is not. Is your compliance trigger still all produce, or is it only covered produce? Does that make sense? Wes, you still with us? Wes, you there? Okay. Well, I got actually a comment coming from the audience that it's all produce, but we may have lost Wes. So I'm going to, and we're approaching our time deadline anyway. So I'm going to sign off now.
I'm back.
Oh, he's back.
Happened. It just disappeared.
Okay. Well, we're wrapping up anyway, Wes. And actually we got a comment that came in and said, "Oh no, we can't lose Wes," from one of your constituents, I suppose. Anyway, do you have any final thoughts before we sign off?
Well, I think the thing is that we have to understand that this is not the final rule that we discussed today. And until FDA publishes that, we don't know what actually will be in it. Number two is even the smallest or even the largest growers have 2 years to start to comply. So it's something that we will need to work with in the future. We may have to have another webinar, for instance, to talk about some of the specific issues. But except for the water, which is, to me, is the biggest concern for growers, I think that most growers can comply with this this proposal.
Okay, and we get one last question that came in that just before we sign off, I'll give to you. The baseline for water testing is 20 samples over 2 years, not 20 samples per year, just a total of 20.
That's correct. It's a total of 20 samples over 2 years.
Okay. Okay, well then it looks like we're just about done, and we'll sign off here. As Christy mentioned earlier, the recording will be, and the slides will be posted at farmcrediteast.com/webinars. That will be up probably later on today. And if there's any follow-up questions, you can email me, chris.lawton@farmcrediteast.com. And I thank you all for attending.